Hi, Wes here from Chester Pridecast, and I've got Olwen here from Fast Track North Wales. Would you like to introduce yourself?
Hi, I'm Olwen Williams. I've just retired as a consultant in sexual health and HIV medicine after 30 years working.
Wow, that's a long time.
Yeah, but the nice thing about retirement is that actually you can become an activist.
Oh,
Whereas when you're actually working and seeing clients who are, who are living with HIV, who are, from the community, although you're kind of advocate for them, being an activist is a very different thing.
That's it. It's very different, I imagine. Yeah. Okay, I've got a couple of questions for you, just to get a gist of what you do and how people can get involved. So firstly, can I ask, tell us what Fast Track is and what do you do for our LGBT community?
Right. So the interesting thing about Fast Track Cities is that it's a world organisation.
Yes, it is. Yeah.
World organisation where the focus is on eradicating new cases of HIV by 2030 across the world and other bloodborne viruses. So we in Wales have actually sort of started off with Fast Track Cardiff. We're now establishing Fast Track North Wales.
In North Wales,
and the idea is to get not just our communities involved, but our politicians, our mayors, our councillors, so they actually can help drive this change.
That's a bit more of an advocacy about it.
Yes. Really, our biggest thing, I've worked in sexual health HIV medicine now for 35 years, and the one thing that's been ongoing through all that time is actually stigma.
Yeah.
So the stigma around living with HIV, the stigma about testing, the self-stigma that some people have when they're
certainly
HIV. So really, the idea here is if we get that big merge of people together, then maybe through actually, eradicating fear, eradicating ignorance, that actually we can tackle stigma.
No, that's a very good cause. Now, leading on to that, what services and information are available for someone living with HIV that you can offer?
Right. As an organisation, we don't deliver any sorts of actual services for people living with HIV. But obviously across, Wales, across the UK, there are dedicated HIV clinics for people who live for their medical care.
Yeah.
But of course, there's a huge amount of organisations in the third sector that looked after, other aspects of their care.
Yeah. So I'd imagine you're quite hands-on with, especially a lot of the healthcare workers. Around this topic. Can you explain a bit more how you are involved with healthcare work?
So one of the things about healthcare workers is really about making sure that everybody is aware of HIV testing. So in Wales, we've got a HIV action plan.
Yeah.
And one of the things there is, myself as an ex-consultant knows everything about, mainly a lot of things about HIV.
You'd hope so after 30 years,
maybe my colleagues don't.
And that's it.
If I was to say U equals U to you, you might say, that's undetectable equals untransmissible. But if I was to say it to one of my medical colleagues, they go, what are you talking about?
That's it.
That's what we want to do, is to make sure that people realise that if someone, pitches up in the emergency departments, they're living with HIV, they've got an undetectable viral load, there's no risk of onwards transmission there.
Yeah.
There's this still equation of HIV equals AIDS,
That's it. And I think personally, when being on dating apps, I personally feel this stigma's got a lot less because you can have your status online, you can have undetectable, and I think there's a lot more education these days around it than there has been in the past.
And of course, I've got to preempt you. We've got PrEP.
Well, that's it. Exactly.
Wow, that little blue pill that appears you can put on your profile.
That's it.
PrEP
Negative on PrEP.
Mega game changer.
Oh, it is. Yeah, big time.
I kind of want to say I've just seen big men cry because all of a sudden they're having fear-free sex in their life.
Obviously there's other precautions needed to be taken, but that one is probably the biggest, isn't it? Yes. So having that kind of weight lifted off a bit, it really does help. So how does Fast Track collaborate with other healthcare providers we've mentioned to improve the healthcare support needed for someone on HIV, and what steps are taken to ensure confidentiality, privacy, of individuals seeking assistance.
Yeah, I think that's one of the things. I mean, if you seek any care within the NHS, you are bound by the confidentiality. But I think people are a little bit worried about this.
Yeah, I think the stigma's still there, isn't it? So you're a bit more wary about it.
But then we've got technology. We've got amazing things like certainly in Wales, we've got a national online testing programme. So you can actually access Sexual Health Wales website.
Oh, wow.
Get your HIV, Hep C, syphilis tests sent out to you.
You can get it all sent from by home, can't you?
You do it from home. Okay, you have to send your little pinprick back, which apparently causes a lot of mess.
Really?
Oh, yes. Yeah. But it's a really good thing from that, and that is in effect confidential.
Yeah.
Slightly you could say anonymous, but it means that actually
it takes the fear away of going to the clinic, doesn't it?
Though we're not very scary at all. We're absolutely everyone I've worked with in sexual health for the last 35 years have been an amazing group of people.
Well, I think a sexual health check in general is quite a scary thing to go and do anyway. I mean, we advocate for people to do it all of the time and to remove the stigma even away from that. But waiting for the results, even though you probably know nothing's happened, you're all clear, there's still that in the back of your mind, like there could be something.
Yeah.
So I can understand having that service where you can just send it off. It's brilliant. Yeah. So just to also ask, how can we all stay up to date with the latest advancements in the prevention of HIV?
Well, I think if you use very reputable websites, things like Fast Track, things like Terence Against Trust, things like Body Positive, and most of the clinics do have actually really good information about HIV. Social media, make sure you follow the right.
Yeah, definitely. I think that's the problem. A lot of people get their information from social media rather than the right places.
And things like Prepster for HIV, I Want Prep Now, really are excellent websites for people to get that information. And of course, come to Pride, because one of the things here is people are doing testing here.
Well, that's it. And we've got the Wellbeing tent over in the back, and yourself and loads of other organisations. It's just a wealth of information. And it's just, I think with having like-minded people around you as well, it makes it just so much easier.
Yeah.
Oh, brilliant. Well, thank you very much for interviewing with us today. We'll put the information on below of the website. And thank you very much.
Thank you.